We did studies in our hospital over how much time registered nurses actually spent on direct patient care. I mean, in the bed, at the patient's bedside, not charting, not on the telephone. And frankly, it was around 30%. A lot of the nurses' time was spent coordinating other departments' activities, like to the level of 20–25% of a nurse's time. Waiting for something to show up, arguing with somebody in another department about what you needed for a patient. And I made a statement once. I said, you know, the pharmacy really ought to consider their primary customer as the nurse, not the patient. It's the nurse that's going to give the patient the pill. And you would have thought that I'd fallen off another planet.
One of the #1 problems for medical surgical nurses or nurses that work on the floors with medical patients and surgical patients is the intensity of the workload, the numbers of patients that are assigned to a registered nurse.
When you cannot go on break, when you cannot see your patients, when your medicines are late, you know, you're always in a hurry because you have 10, 11, 12 patients to take care of. And after you take care of patients, you have your documentation. You know, you have 10, 11, 12 charts. And when we work on the medical surgical floor, we don't have any secretary to put our orders into the computer. We used not to have any pharmacist, so we mix our own medicines. And when you do that, you know, there's more chances of error.
I guess what I'm trying to say, we don't have time to sit there and hold their hands and say, you know, what can I do for you today and help you?
And
that
you
kind
want
of
to do
thing.
that.
Yeah, I think that's what nursing's about.
And when you don't have time to talk to them, you know, you're always in a hurry. You try to kind of, you know, talk to them, but you don't really, you know, your one foot is already out the door because you don't have enough time to spend to even comfort patients. And when they're very sick, you know, sometimes you may miss some very important signs that something else is going on, only because you're always constantly running.
The nurses are working on the floor, time pressure, and their, you know, assignment load is the same, or even more paperwork-wise involved, and we just don't have enough time to spend, you know, sit at the edge of the bed and just talk to patients.
The fact is that a nurse is a professional. She needs to be considered a professional by the physician and by the patient that she serves. But when your nurse is only filing paperwork and is asking crazy questions that have nothing to do with, you know, your immediate needs, and you're a patient who's in pain, you don't really appreciate that she is the professional.
The shortage got worse, and some people in executive suites had to make some decisions about what was going to happen to their nursing staff. They could continue to treat them like second-class citizens and replace them. You know, turnover rates were up in the high 30s in those days. Or they could look at the role that the RN had in the hospital and do something about it.
Patients that come in are in crisis, most of them, and you have to be on your toes. And at the end of a 12-hour shift, which I like better than the 8, you mentally and physically, if you are a nurse, totally exhausted. They're just not going to do it for the money that they're making, which has been cut down, and for the hours that they have to do, 24 hours a day, 7 days a week, weekends. A business clerk gets off on weekends and makes more money.
The patients who were being admitted were much sicker. They had higher acuity, and actually you needed more nurses, not less nurses, to care for the patients that we're seeing now in our hospitals. And so the nurses were becoming very frustrated. So you had nurses who were saying, well, I didn't get laid off, but you know what, I'm going to leave.
And finally, on the image of nursing as a cause for the shortage.
The president of Iota Kappa Chi, our nursing organization, has gone out, and they talk to these students, and one of the things that's come out, well, nursing, gee, well, that's just like, you know, a blue collar, that's not a profession, is some of the things that have coming out. So we really do have to look at our image.
I think that the nursing profession has not been, I guess, as respected, if you will, as so many other professions.
I think of 6 foot, blonde hair, with a short skirt. I'm being totally honest.
What characteristics?
Somebody that'll take care of you, somebody that that'll comfort you, somebody that, you know, that you could just feel comfortable with when they're trying to take care of you.
And when I think of nurses, I think of them like paramedics. They're worth their weight in gold. They're very special people.
There has been a tremendous effort on the part of our nursing profession by the American Association of Colleges of Nursing, by National League for Nursing, by even during the Olympics. Remember, there was the 30-second ad as to why one needs to be a nurse and why a nurse makes a difference.
Well, it's more like angel to me. Take care of people. That's what I feel.
My perception of nurses are someone that helps you when you're in probably deepest trouble.
You think of them as being very capable, being very level-headed. They're not a lot of times when you go in the hospitals, you and the family are panicked and they just need to calm you down. A lot of times, most of them are fairly pleasant people to calm you down and help you out. So it's kind of basic impressions. Smart, a lot of them very smart people.
Someone to care for me, you know, with patience and bedside manner.
They do more than their share of a 40-hour work week, and I believe that they should get the salary and the pay and the declaration that they deserve, because they're more of a healthcare professional that really caters to individuals' needs, and they're not related to the politics of the HMOs.
Nursing has become more desirable as people recognize what nurses can do. I think nursing has had an image problem in terms of people being able to say, well, a nurse is a nurse is a nurse. And the public isn't always able to differentiate what different levels of nurses can do.
There are very few children or teenagers, I talk to them, what about nursing, you know? And I'm not going into that. They don't pay you enough. I can make just as good being a secretary, and I can be off weekends.
And the healthcare delivery system itself has not used nurses in their own depiction of their marketing programs and their various efforts. When you see a local television station highlight a particular new diagnostic or piece of equipment, it is rarely a nurse that they interview to provide that.